this master class as part of the GIC proceedings this year. This master class is entitled Experience Using the ExpandNet WHO Framework and Tools to Achieve Country Ownership and Sustainable Scalable Implementation Results. My name is Laura Ghiron, and I'm a member of the ExpandNet Secretariat. And in providing this masterclass, I'm joined by two very special ExpandNet member colleagues. The first is Dr. Alexis Ntabona, and the other is Mr. Charles Kabiswa. I'll introduce them more in a few minutes. Before that, though, I would like to share the ExpandNet framework and approach with you, since this is a workshop and we're intending to share some of our theory as well as experience. And so I will lay out the framework very briefly in a cursory way and talk about the approach that ExpandNet uses to support the scaling up of many different types of interventions in many different countries. And then you'll have the benefit of hearing from Charles and Alexis, who will discuss their experience with applying. So ExpandNet, just to summarize quickly, is a global global network of health and development professionals who've been working to advance both the science and practice of scale up. And we're really excited about the GIC this year because we have all worked hard to get scaling up and sustainability on the agenda. And so you'll see this is one of the sessions that's explicitly focused on this topic. And this is because we believe that scale up is a very critical part of implementation, and we would like everybody to be really savvy on scaling up and learn as much as we all can so that we can really try to help achieve the Sustainable Development Goals and other targets that we all share in improving health and development. So I want to share my slides and tell you about ExpandNet. So let me do that right now. Sorry, we have, thank you. Okay, and project. There we are. Hopefully you're seeing the right screen. Charles, give me a nod. Okay, so ExpandNet was founded back in 2003, and we have been working on this issue of scaling up for that long and longer, trying to really help people wrap their heads around a complicated process that can sometimes be 2 steps forward, 1 step back. One of the things that we realized when we founded ExpandNet back in 2003 was that there wasn't a really solid definition of scaling up. And so as we were all sitting around the table from, I think we had about 10 countries represented at that meeting, we hammered out a definition that was consistent with the way those of us who were working on the WHO strategic approach to strengthening reproductive health policies and programs, the way we were working in different countries, and as well as some other scaling up initiatives. We brought all these experiences together, and this is the definition that we arrived at, which is deliberate efforts to increase the impact of health or other development innovations successfully tested in pilot or experimental projects so as to benefit more people and to foster policy and program development on a lasting basis. And each of these bolded components of the definition has a lot of thought behind it, a lot of weight, because, and sometimes we give a whole little lecture around the definition where we point to the deliberate nature of scaling up. We talk about innovations because that comes from the diffusion of innovation literature. It just means something new. It can be any intervention, but new in that setting. Successfully tested talks about we need to understand if there's an evidence-based intervention that we want to introduce, but we want to understand how to implement it locally in that particular setting. And then benefiting more people points to this sort of horizontal rollout of an intervention package to new areas and new populations. And this is what a lot of people think about when they think of scaling up. But there's also this other component. It's called vertical scaling up or institutionalization. And the definition refers to it here as fostering policy and program development. And this is a very important part of scaling up. And we will talk about this later. Finally, the definition points to the issue of on a lasting basis, which is really the focus on sustainability. Because if we're scaling up and scaling up to all these new areas, but we haven't properly anchored our intervention package and ensured that it would be sustainable at minimum where we've been implementing it, then there isn't much point in continuing the scaling up process. So one of the things that we learned when we were sitting together was that scaling up is really an organizational management, policy, and political task, and not just narrowly about any one particular technical area. So that enables me, that understanding to, although my background is in family planning and reproductive health, I've recently been working with people who are working on sustainable fisheries to try to apply our framework to their work. And that's how a demonstration of that. But one of the things that we really learned is that scaling up doesn't happen spontaneously. It doesn't work very well if approached in an ad hoc manner. And therefore, systematic planning for scale up is really essential. And that's ExpandNet's key message. So what is a systematic approach to scale up? Well, ExpandNet would suggest that really scaling up thinking has to begin at the very earliest stages, from even when we're planning and designing an experimental project, some kind of implementation research, any kind of test. We want to be sure that it is implemented and designed in a way that looks ahead to its future scale up. And I'll come back to that in a moment, but then once you have evidence that this intervention is successful, it's addressing what you want, it's relevant, all of that then one would proceed to developing a scaling up strategy. And this is something that ExpandNet has worked really hard to support these processes of developing strategies, and we'll come back to that too. And the third stage, which is often the lengthiest and the most neglected, is strategically managing the scaling up process. And this is where a lot of projects often end. They end right at that moment where there should be really thinking about how to support managing the scaling up process. So ExpandNet has developed a set of tools and resources, this first one being a book that was our first product that highlights our framework, and then 7 country case studies. And the second one, when people were saying to us, wow, that book is really interesting, it's great, but how do we actually do scaling up? And that's when we developed practical guidance for scaling up health innovations. And this is much shorter and more applied. It has lots of examples of scale up experience. Then they were saying to us, well, but how do we plan for scale up? And that's where we developed this guide I was pointing to, which is 9 steps for developing a scaling up strategy. And both Alexis and Charles will talk about their applications of this guidance and what was the benefit as well as some of the challenges. And of course, all of these tools are available as well as many other resources, including a very lengthy scaling up bibliography on the ExpandNet website at expandnet.net. So the most recent tool that we developed is that one for that very early stage on that scaling trajectory called Beginning with the End in Mind, planning pilot projects and other programmatic research for successful scaling up. And we came to develop this tool because people, when we were supporting the development of scaling up strategies, people were saying to us, oh, if only we had thought about some of these issues sooner, we would have been in a better position to be scaling now. And so that's why we most recently developed this tool. And so, of course, on the website. And so when we're developing pilot interventions or implementation research projects, ExpandNet wants everybody to keep 2 really important things in mind. We don't just want to know whether interventions are feasible, acceptable, effective, efficient, and improve education, health, or whatever. That's called maybe a proof of concept phase. We also want to know if they can be successfully implemented not only in pilot projects with special resources, but in the large scale program. In other words, in the organizations, or we call that the user organization, that's intended to adopt and implement this on a large scale. We really want to understand the proof of implementation. We want to understand, how does it work without all of those special resources? So this is the ExpandNet framework, and I'm not going to go into it in huge detail because I want to give lots of time for both questions and for Alexis and Charles to share experience. But I would like to ask that anybody, as we go through our presentations, that you feel very welcome to put questions in the chat area, and we will take those up in the last half hour of our session. So the framework is laid out in two of the tools, Practical Guidance and the 9-Step Approach document. And so I'm not going to be able to go into tons of detail here, but it is really helpful to go through those tools and understand each of the elements in the top half of the framework, as well as the strategic choice areas and how they relate to one another, and how changes in one might affect the others. All of that is laid out in the tools. But I am going to dwell a little bit on the innovation, because that's often what we're focused on, and the resource team and the user organization, because I think hearing a little bit about those will also set the conversation up for Charles and Alexis to share some of those experiences. Okay, so the innovation, this is the what. This is, what do we want to scale up? This is usually a package of interventions. This is something that is designed specially for a setting, and there are many lessons about how to do that well and what makes that more scalable, and that's where the tools come in to try to help you. Here's a few key lessons about the intervention package. Basically, that it is usually a package and not a single intervention. And then from ExpandNet's reviews of literature, which we did extensively in developing the framework, we looked back to the 1940s, 50s, and 60s, because scale up is not something new. It's not a new concept, but the learning about scale up that has accumulated over the years under many different names, like research utilization, diffusion of innovations I mentioned. The political and policy sciences have been very concerned with this issue, as have the management sciences. So we tried to review all of those and assemble our framework. And they all agree on several key principles and lessons, and these are some of them. Number two, the amount of change that this innovation represents from how things are currently done in the system or the user organizations, I'll come back to, that is typically a major determinant in how quickly scaling up can proceed. And so that's something to keep in mind, and I will come back to that. And the third one is that innovations that have the correct attributes, and this is an acronym, they're easier to scale up. And of course, none of them have all of these correct attributes at one time usually, but any scaling up strategy will work on trying to maximize or strengthen any of these particular variables. So this is the correct acronym, and people really like this because it makes analysis of the intervention package a bit clearer, instead of just trying to do an ad hoc approach. And so I'm not going to go into all of these, but some that are particularly poignant are the ease of installation, the compatibility with the user organization, and the relevance. They're all important, and they all bear analysis and reflection and really working on. I think Alexis will come back to these. Okay, So the resource team. The resource team, these are the people, as you can see, they're sort of closely connected to the innovation. They were often involved in developing and testing the innovation, but they're also those folks who seek to promote its wider use. So when we're ready to work on scaling up, we often bring new members to the resource team because we have new needs. We have additional skills that are needed. And then also members of the user organization, who are those who are intended to adopt and implement the innovation. In other words, we're trying to get this innovation used by this group. This resource team here should include members of the user organization because they are key informants on how the user organization really works. And sometimes when non-governmental organizations design and implement an intervention package without sufficient involvement of the user organization, then there are disconnects in how implementation should roll out. And that's exactly why we need a proof of implementation phase very often. So I've already mentioned one of the key lessons that we need to bring in new skills often, because maybe research was a very heavy emphasis during the pilot, but it will be less emphasized during scale up. But advocacy may not have been important during the pilot, but we now need to ensure that we have strong advocates, also those who can mobilize resources. All these kinds of skills become more important during the scaling up process. And another key lesson is that scaling up is facilitated when ownership of the innovation rests with the user organizations. And there's not this perception that the NGO is the one who owns the intervention package. And finally, continuity in the resource team also facilitates scaling up, because those who are involved in testing really understand the nuances of how implementation succeeded, and they can have important contributions to the continuity of a scaling up process. Okay, so the user organization. These are the institutions and the organizations who are expected to adopt and implement the intervention on a larger scale. And there's many lessons about the user organization that tell us from this literature review that we've done earlier and even current experience that tell us whether the user organization is ready to implement this intervention package on a larger scale. And if it's not completely ready to implement it, then one needs to consider those capacity strengthening activities as part and parcel of any scaling up process. So here are some of the attributes of a user organization that are more likely to lend themselves to successful scale up. They should perceive the need for the innovation. They should be willing to support it. There should be commitment. They should have the necessary capacity and the decision-making authority. And if they themselves, let's say we're working with the Federal Ministry of Health, if they themselves don't have the decision-making capacity, for example, on resources, then you need to also bring other user organizations, like, for example, a Ministry of Finance or Planning. You need to bring them into the process so that they will help support scaling up. And then, of course, the timing and circumstances and effective leadership and advocacy. So that's sort of the upper part of the framework. And then, of course, there's this whole area about the scaling up strategy, which is like the centerpiece of the framework. And it's comprised of all of these strategic choices, which I won't go into today, but want to point you to the resources on the web. And just tell you that really this is a systems framework, and we want to think about how changes we're making in one area affect the others, and how there's a critical role for all of these activities based on the type of scaling up that we're working on. And I will mention that there are 4 main types of scaling up. The first 3 are guided types of scaling up. In other words, they're deliberate, as in the definition. They include that horizontal rollout that I was mentioning. They include, that's also referred to as expansion or replication. They include the institutionalization or vertical type of scaling up. Those are the main two that we work on. The third deliberate kind of scale up is called diversification, where we might see the need to add an additional intervention to our original package, although it may not have been tested, but we add it along the way because we see that it's required. And that's called diversification. And the fourth type, which is not guided, is called spontaneous scaling up. And there is a lot to be learned from that. There's also maybe some navigating whether it's going properly or not. That is an important activity as part of any scaling strategy. So I mentioned this a little bit when I talked about the innovation, namely that the degree of change that the innovation package represents from how things are currently done is a very important consideration in how the pace of expansion should proceed. And this is also in relation to how many resources there are to support the scaling up process. And this whole interrelationship is very important to understand and to be following. And as you are able to develop additional resources, you can hopefully expect that your pace could expand. But this is a key lesson that I just wanted to emphasize before I give the floor over. And that there are trade-offs to be made in these interrelationships. And that all of this is taking place in this larger environment that affects these interactions. So that's one key scaling up lesson to leave you with. And the final one that I want to leave you with is that, and I think I mentioned this already, but expansion and institutionalization, they both are very critical. In other words, if we keep expanding to new areas, but we don't make an effort to anchor the intervention package carefully in systems that will support the expansion process, then we won't achieve sustainable scale up. And I'm going to leave you with that, thought because it's relevant to what my colleagues are going to talk about. So let me first introduce Charles Kabiswa, who is a very dear ExpandNet colleague. And Charles will be talking about the health of people and environment in the Lake Victoria Basin project. Otherwise, we refer to it as HOPE-LVB or just HOPE. And Charles has been working on such integrated projects for many years now since HOPE. But moreover, for the last 15 plus years, he's been working in East Africa, in Uganda, his country, but other countries as well, to address lots of different natural resource and development sector issues. And these include conservation, health, socioeconomic issues, sustainable livelihoods, and also at the policy and legislative level, working on climate action and mitigation. And really, Charles has been a key actor at the national level on climate change and how Uganda is facing these issues. And so Charles is going to talk about the population health and environment integrated work of HOPE-LVB. And I really am excited to hand over the floor to you, Charles. So please go ahead.
Thanks, Laura, and thanks for the presentation. I also want to appreciate colleagues who have joined us. I'm just preparing trying to ensure I get share screen. I think Laura, okay, this is it here. Sorry for the colleagues who have joined us this evening. I appreciate Laura's presentation, and mine is more of bringing the practice part of the discussion. Already my introduction has been has been made by Laura, so I'll just go into the presentation. Over the past years, we've been guided by the ExpandNet World Health Organization tools to design and implement projects that kind of beginning with a scale up in mind. So one of them that I'm sharing in this platform is the project we call Health of People and the Environment in the Lake Victoria Basin. This project was implemented in 2 countries, and that is Uganda, Kenya, and because it is an integrated in nature, it brings different sectors of health, population, and environment together. So we had multiple or multi-stakeholder cross-sector partners, including Pathfinder International, Conservation through Public Health, and a number of environmental and health organizations within the East Africa. But of course, since we are using tools to inform our scale up, we had technical assistance from ExpandNet, the team that developed the tools that you have, that Laura has shared, as well as Population Reference Bureau and Balanced Project. But also the good thing is that the nature of the project required partnership in terms of funding from different sectors. And we got support from USAID, MacArthur Foundation, Packard, Ban Wilson Foundations. Just to inform you that the project had phases. It actually had 3 phases, more or less linked to the scale-up phases that Laura has shared. And in each phase, a different tool was being applied. But just to take you through that, this was a project with a goal to reduce biodiversity conservation and ecosystems degradation. At the same time, increasing access to family planning and reproductive health, as well as improving maternal and then child health. What I want you to note is how we stated the strategic objective, which was to develop and demonstrate and test a model. You can test a model for population health and environment within the Lake Victoria sites that can be adapted and scaled up in communities at local, national, and regional governments. So also you note the word adapted and scaled up because these were critical, and we had to choose the right language because we were designing this with a scale up in mind right from start. For some of you who are not so familiar with I will keep on saying PHE, but PHE stands for Population Health and Environment. So our model, those of you who are not familiar with the PHE integration, our model had a number of integrated interventions, and under population, you note that we had family planning, information service provision. Then under health, there was reproductive health, maternal, water hygiene and sanitation, as well as nutrition. So environment integrated or was composed of sustainable fishing, agriculture, biodiversity conservation, and then sustainable livelihood. So you can see how integrated the approach was, or the model was. But all of these were being demonstrated within the pilot model households in different villages across East Africa. And we had key processes which included participatory needs assessment, some research that informed the baseline, community engagements, building capacity, and system strengthening, especially the health system strengthening, monitoring, reporting, as well as advocacy. But we had gender and youth cutting across in all these interventions. So the HOPE-LVB, that's the health of people and environment, began and was implemented with sustainable scale up in mind. Very important to note is that planning for scale up for us began right away at the design stage. And then the implementation was strategically managed for sustainability, as well as future scale up using the ExpandNet World Health Guidance, World Health Organization guidelines, which you are now familiar. So I am just picking a few key elements that were very, very critical in our design and implementation. A lot has been said there about the relevance of key stakeholders to inform, but also to get the buy-in for any successful project. And one of the key elements within the tools was to involve key stakeholders across levels, and that's community, national, and regional. And the reason partly was because we were implementing a cross-sectoral project, and there are a number of vertical P, H, and E sectors, and we wanted to have these sectors working together. So we had to engage a longer list and later maybe the short list of line ministries and agencies across different sectors, as I've already mentioned them, and as well as CSOs who are implementing any of those facets or all of them. So that was very important. I think Laura has talked about the user organization. This was very critical. And the community members were part of the key stakeholders. Then that bold one is the Lake Victoria Basin Commission. This is a regional body that manages or enforces and ensures there is sustainable management within the Lake Victoria Basin. And this is the East African Community Regional Body. So that was our high-level stakeholders, because the intervention or the model was cutting across different countries within East Africa. And the other issue was we kept on analyzing the approaches or the interventions or set of measures across different dimensions. So periodically we were asking ourselves, again, guided by the model or the ExpandNet guide, how feasible are the interventions proposed or being implemented, relevance, how are they practical, is there affordability? Affordability was also assessed within the current intervention, but even in future, because you need an innovation to be also as cost effective as possible to take it to scale, as well as timeliness. We measures also, we analyzed across the effect on the environment and different ecosystems, because we were working in fragile ecosystems within the basin, and also ensuring that these proposed measures are supported by the key stakeholders at various levels, as I've already discussed. The issue of consistency of what we are doing with the regional, subnational policies and the service modalities was very critical, because we couldn't do things which are contrary to the policies or frameworks within the two countries, as well as assessment, continuous analysis of the potential of the measures for sustainability and scale up. So we kept on testing the model that was under routine operating conditions, but also existing resource constraints as much as possible. So in many cases, we used it to kind of change the approach of modality, including disqualifying some of the proposed interventions. One example was in the first phase when we were working on agroforestry interventions, we had planned to implement the tree planting guided directly or heavily guided by our project personnel. And we were working with the model homes. But then later we realized that there were strong groups within the community at different levels, like environmental officers, sub-county environmental, and the village environmental committees, as well as the community members. So we shifted the approach. And that is a way of making sure there's ownership, but also there's a way of building local resource capacity, who in the future will help the scale-up process. And we did that even within the health aspect, whereby instead of creating parallel structures to implement our health measures, we worked through the Ministry of Health, and then we tapped into what we call community health workers. In Uganda, we call them VHTs, or Village Health Team. And this was a good strategy which was appreciated than creating parallel structures. And these were key resources in trying to especially accelerate the integrated models or activities which we had planned to do. The other aspect, which sometimes many practitioners don't think about when scaling up, is the source of funding, and that is the support beyond the pilot. We didn't wait for the first phase actually to end, but we began during the pilot phase to engage a broad range of possible supporters, but also to ensure that the scale-up process can proceed beyond the pilot. And this included reaching out to the current and the new partners and stakeholders to garner the interest in trying to ensure that there is some interest for them to either replicate the model, also financing beyond the pilot. And in Uganda, we worked with the National Population Council, which is under the Ministry of Planning, and as well as the Lake Victoria Basin Commission. The interest here was how can we have these institutionalize the PHE approaches within their national plans and also action plans. And I think that's what Laura referred to as the institutionalization, which is very, very critical for sustainability and also scale up. The other thing which you are familiar now is the user organization. We kept on tapping into this, and within East Africa, there are some networks like the population health and environmental networks that we brought on board, and these were targeted at the start, but also going forward, interesting them and working with them to ensure that they can replicate the HOPE-LVB model or the PHE integrated model. The other key element where we picked stronger deliverables was the examples of documentation and sharing lessons, including the first-hand experience. So we developed ongoing or continuous tools and deliverables and the products, like the toolkit to support other actors who want to replicate the model, as well as ongoing capacity building, both at government and non-government level. The key lessons were shared, and we have a lot of these free online documents that we are sharing up to now. So we have used so many platforms, but important thing to note here is the use or how important it is to generate evidence to inform advocates, but also coming up with the tools like the how tools, because when you are engaging in new user organizational institutions, the thing they ask, like the most of you might ask, how did you make it? So the how-to tools are some of the basic tools that we developed, and then they were well illustrative with good demonstrations of a successful project, and this guided a lot in the scale up. The other thing is scale up strategy, which is a very, very critical element in trying to manage scale up and actually looking strategically managing the scale up process beyond the pilot. Now here, you note that we had phase one, which I've already discussed. And this is now where we started phase two. And in phase two is when we developed the scale up strategy. And started in phase two, but we continued beyond the project period because already, as you have noted, that we had built a stronger movement of practitioners, a strong movement of interested groups, and the government kind of buy-in. More elements of institutionalization were so much registered. So we had to continue doing the kind of continuing beyond just the phase of phase two. And here, I want you to note that the phase two now, the goal changed. Again, we were very careful choosing the words that reflect scale up. And now the goal had to change, looking at institutionalize the use of our model, which is the HOPE's integrated PHE model in the Lake Basin as a model for sustainable development. But let me also share two of the four objectives, which again reflect the scale up beyond the pilot. Here now, what came as objective number one was to define and package the model in order to disseminate the approach, but also facilitate capacity building of other organizations who want to replicate the model. But look at also 4 that says and identify and support program and advocacy mechanism which promote multi-sector planning and management for the integrated model for sustainable development. This again reflects or just focuses us back that we are still on the road to scale up. So it was very important that all this guidance came through the level of developing the strategic, developing the scale up strategy. Now, out of all this, I managed to pick some key outcomes from our efforts to scale up in Uganda. And there's a lot of policy changes which were registered, including integrating family planning in climate change policy of Uganda. We influenced a lot on local government development plans. And then the Uganda Family Planning Coastal Implementation Plan, adopting our household integrated model. Right now, the National Population Council supports population health and environmental coordination, and it brings together line ministries and CSOs under what we call the National PHE network. It is still very active now and very, very relevant in the region. But also the strategic plan for the National Population Council 2026 integrates population health and environment, and there is funding which is allocated to a number of activities, including replicating the models and using the sites as visiting places for learning and passing on capacity for new user organization. So there are a number of PHE projects in Uganda that are active in over 10 districts. They're actually over 10, and a lot of new funding streams which has been registered to work on population health and environment in new areas in Uganda, as well as few universities, like 2 of them, who have adopted or started courses on population health and environment in Uganda. Remember, I told you that we targeted East African community, and under Lake Victoria Basin Commission, we, as the project and the stakeholders, entered the MOU. MOU is the Memorandum of Understanding with the Lake Victoria Basin that served as a platform for collaboration on the PHE model. So right now, Lake Victoria Basin Commission plays a leading role on the PHE scale-up within Rwanda, Uganda, Kenya, Tanzania, and Burundi. So there are a number of policy strategic documents which were developed, like the strategic plan on PHE, as well as the operational plan on the same M&E framework. Most important was they designed what we call Lake Victoria Basin PHE minimum package of services, more or less of the framework which I already shared in one of my slides that shows different elements under PHE and how they can be implemented. There are a number of guidelines which have been developed in the region, and the regional PHE prototype curriculum has been developed. So many platforms like conferences share experiences, and then the knowledge products, and all this can be accessed online. Now, in my conclusion, we did as much as possible, of course, with the technical assistance from like ExpandNet and other stakeholders, to provide an illustrative example for how diverse projects and fields can plan and implement scale up, with quite a number of online documentation which are available. And you've seen some successful stories from an extract of scale up. Then another thing to note is scale up need to begin from project design, as you've seen how we phased, but also informing strategic languages to keep us focused, and also choosing different practices that are scalable. And then you have to progress through the planning, implementation, as well as managing scale up. So it requires time for reflection and the planning process from project pilot to a larger scale impact. As we've noted, a number of policy frameworks within the region, it is very, very important to make sure that you consider or you advocate or influence policy and institutional framework to support scale up. Otherwise, what you need to scale up might be out of the context of the government bodies or different line ministries and institutions, and it can affect as well institutional scale up or vertical, including horizontal scale up. Decision makers as well as funding agencies, from our experience, need to be convinced by evidence, by good research, good documentation, and first-hand experience that there is a proof of concept. This works, so we can scale it up. So without evidence, we are likely to get problems, or you may face challenges of having a successful scale up. But again, in our implementation, we had vertical sectors. So funding streams tend to be highly verticalized, as you may know. So making scale up of integrated models or approaches like ours very, very hard. That's what I have to share for now. And thank you for listening to me. I will hear from you and respond to any question that comes along. Thank you so much. Thank you. Over to you, Ro.
Thank you, Charles. It is such a great pleasure to hear you discuss the HOPE-LVB project with this lens, and to share with everybody the incredible, powerful experience of scale up in that project, which is a very important model, as you've explained, for the region, and really is having continued influence, even though the project officially ended a few years ago. And also, of course, very rewarding for Alexis and I personally, since we had a chance to work with you and the team in the earlier years, and just a really incredible experience. And for people who would like to read more about HOPE-LVB's learning, particularly focused on scale up, there are 2 manuscripts that are available on the ExpandNet website under the resources and tools pages. So and that's exactly where you'll find the ExpandNet tools. So I hope that you will take advantage of that. And perhaps Felicia even can put, I'm not sure, we did provide these links to these, or these actual documents, as background reading for this session. And so I'm not sure if Felicia can make those available somehow to the participants and everybody. So
I will do my best.
okay, great, thank you. So, and thank you, Charles. Now I am super pleased to introduce Dr. Alexis Ntabona, who is also a longtime and actually founding member of ExpandNet. And Dr. Ntabona is based in Kinshasa in the Democratic Republic of Congo, which is his home, and but he was away from his home for a long time, and now he's back for the last several years. So Dr. Ntabona is an OBGYN who trained at the University of Kinshasa, and later went on to study his master's in public health at San Diego State here in California, where I live. And so Alexis taught and directed the community medicine department at the Faculty of Medicine, School of Public Health at the University of Kinshasa for several years. And that was before he joined the World Health Organization, where he worked first at WHO's regional office for Africa as a regional advisor for safe motherhood and then reproductive health more generally. And after that, he moved on to the WHO headquarters in Geneva to work with the Department of Reproductive Health and Research, where he, for 10 years, coordinated the department's work on technical cooperation with countries. And as a founding member of ExpandNet since 2003, he since his retirement from WHO, he has been providing technical support on scaling up, in particular developing scaling up strategies and building capacity for scale up in many countries, in DRC most recently, but also, as I said, with working with Charles in Kenya and Uganda, other countries, Mali, Madagascar, you name it. And as I said, Dr. Ntabona lives in Kinshasa now, where he is working with several Gates Foundation funded initiatives focused on family planning scale up, as well as supporting other Francophone countries with their scale-up work. And so I would like to hand over the floor to you, Alexis, if you will use your video and unmute if your bandwidth allows while I set up your slides. Let me share my screen.
Thank you, Laura.
Yes, my pleasure.
And thank you for helping with the slides, because from this end, it might be very difficult.
Absolutely.
So I will try and build on one of the conclusions which Charles mentioned in his presentation, where he says that policy and institutional frameworks have to support the scaling up phase in order for it to succeed. And this is what we'd like to see, that it is happening, I think, in the DRC, Democratic Republic of Congo. I'll continue saying DRC. As they started an initiative a few years ago in 2014, which consisted in integrating or scaling up the family planning competency-based training in nursing schools, also midwifery schools, but they go together here in DRC. Next slide. This was part of a bigger undertaking which was starting in 2014, and it was important to anchor this initiative within some of these efforts which were ongoing at that time. For example, the initiative needed to contribute to ongoing effort to implement the first national family planning strategic plan, which was developed for 2014 and 2022, and it's continuing for the next strategic plan, which is being elaborated. It was also important that whatever innovation initiative we're going to put in place, it would contribute at least to all the systems pillars, but particularly two which were identified at that time. Those are developing qualified human resources for the health system, and also increasing access to basic services through the family planning community-based distribution. Next slide. It is through that thinking that Tulane University and their partners started the phase, which was to test the intervention, the package of intervention, and with a very implicit but very clear in mind that they will try and scale it up. For phase one, which is the design of the innovation and getting the proof of concept, it was meant to do the testing, a new approach to strengthening community-based family planning services by providing evidence for two main scale-up related program research questions. Next slide. And those questions are, we are in the context of health regulatory context in DRC, where during that time, the policy was made or had been in place for many years, which doesn't allow the nurse students to provide neither services or even let alone providing injectable or other methods which could be available in the program. They were not involved in the service delivery component. And since this was a kind of a policy window which the researchers wanted to see how it can be used. The first question was, is it safe, feasible, effective, and acceptable to involve medical and nursing students? I'm putting medical in brackets because they have not gone beyond the testing phase. Nursing school students in the provision of contraceptive methods to clients at the community level. That was the main question. The second question was, if this is proven to be really safe, effective, and feasible and acceptable by the clients, would relevant government authorities be willing and committed to integrate this innovation into ongoing pre-service nursing education reforms and widely, I emphasize the and, widely promote adoption of the practice into existing competency-based training approaches within the nursing school systems. Next slide. It is within this that the implementation of the first phase took place, and eventually at the end of the first phase of testing, they were very happy with the results, which encouraged all the stakeholders to now explicitly say we need to make sure this approach can be not only expanded, but institutionalized and sustained. And that's how, at this point in time, they turned to WHO and to ExpandNet to see whether it was possible to use the guidance which was available for discussing the scaling up issues. This was the starting of the first phase, and I hope you still remember that arrow which is going from beginning with the end in mind to developing a strategy and managing the scaling up phase. So we were now at the second aspect, which was we needed to make sure that all the stakeholders know about this ExpandNet scaling up framework, and they were committed to to develop a strategy which will scale up not only the new community-based service delivery approach, but under the leadership of the government authorities, they will support at least this initial 2-year implementation phase along the lines of the recommended actions in the strategy, which is, as you recall in the previous presentation, the proof of implementation need to be obtained after those 2 years. Next slide. It is within that context that they used an approach which is more of learning by doing, because we were now tackling the phase of managing the scaling up process. And I need to report that at this point in time, at the end of the 2-year initial phase of implementation, they were focusing on 4 elements. First, to make sure that every change that is happening, whether it is a success or a challenge, which is facing the implementation of scaling up phase, both within and outside nursing education and service delivery systems, need to be known and documented. Speaking of documentation, they needed also to identify and document key lessons learned, because these lessons needed to guide iterative participatory planning and chart the way forward, which is making some corrective measures and adaptive measures to make sure that the innovation is actually taking shape for scaling up. Next slide. The third element which needed to be monitored very clearly was has a new training curriculum been effectively done, and how it is being adopted in the nursing school system. And the fourth one and the last, which were actually critical during the two initial year of implementation, remember the correct attributes. We wanted to see how in the process of implementing, we can see how some of these can be strengthened. In particular, the focus was on seeing how this innovation will really be easy to install in the nursing school system, but also whether it will present a relative advantage to use this as part of the service delivery model. And this needed to be kept as much as possible because that is what we are using for advocacy for continuing and additional multi-level support locally and internationally. And at that stage in 2017, 2019 and 18, when we finished the scaling up, initial scaling up phase, next slide, we were faced since 2019 and last year, especially during the COVID, during pandemic, we are facing with two major challenges, which are related to making sure that the DRC nursing and midwifery education system will build on whatever successes we received and whatever adaptation may be needed so that they can sustain the integrated family planning competence-based training in the schools and the service delivery approach in the community and possibly expand this nationwide. In this case, I could report that we are now out of 26 provinces, we are now in 10 provinces so far, and more than 200 schools are now have adopted the new curriculum, but we are facing two major challenges. One is that there is a big mounting pressure for more complex adaptation in terms of the content, the context, and the organizational aspects. And also, since the policy window most of the time, or window of opportunity most of the time doesn't last long, we need to see how we can still keep the increased political commitment and the resource mobilization nationally and internationally. I'll stop there and wait for the questions. Look forward to discussing with you some of the aspects which need to be clarified. Thank you.
Great. Thank you so much, Alexis, for sharing that exciting work in DRC with nursing schools and the incredible progress that's being made in terms of reaching increasing numbers of provinces. It's really an incredible experience. So at the moment, I don't see any questions in the chat. So there are unfortunately not that many participants with us, but we would like to engage with you all, first of all, to answer any questions that you might have with regard to what's been presented. But also we can have some time to have a larger discussion around scale up and what some of your questions or concerns and experience, most importantly, have been. And so this is where we will invite you to use your microphone and use your cameras to just jump in because we have time. We have 25 minutes in our session. Of course, we'll let you go early if there's no more to discuss, but we definitely want to hear from you and have a chance to engage in dialogue. So please go ahead and unmute yourself if you want to comment on anything. And if I don't hear from you, I'm going to ask you some questions. Anybody, the floor is open. I see there is not anything coming up to the surface, so maybe, Felicia, did you want to ask us a question? No. Okay, so here's my question for you all. So you have heard now from us about some of our big learnings from our experience from our reviewing literature and applying ExpandNet tools in the field. And so we would like to hear about some of your learnings, either from your experience or your observations, where you have seen scaling up processes unfolding. What have you learned about what makes scaling up succeed or what makes it fail from your observations or from your experience? We are putting that question out there and hoping that somebody will take us up on answering it. I see that there are 5 people who, or maybe 6 people who are, participants in GIC who are with us. So please feel free to just jump in using your microphone and or your camera. We'd love to see you.
Hi, thanks for the presentation. I just reflect quite a lot on the idea, and I think it's one of the toolkits around readiness. So I think readiness is critical for scaling up.
And can you just elaborate on your concept of readiness so that we can, I think I know what you mean, but I would love to hear you elaborate.
Sure. So my concept of readiness, and maybe it's not exactly correct, is how the recipient of the innovation or whoever will be implementing it directly has considered all of the elements of the innovation and understands what needs to be done to make it a successful implementation within their scaled environment, whether that be one part of the scale up or whatever that might look like. Yeah, that would be my understanding.
Good. And Kitty, just clarify for us, what about readiness do you want us to address?
I just based on your question, what makes it successful, I would just like your opinion on how important it is to you, that first toolkit, or in terms of readiness, and what you've learned from, I guess, much larger scale than I've done, how you would ensure readiness, or if it's of a key value to you.
That is a wonderful question, and I really appreciate it. And I also appreciate you sharing with us the concept of readiness here, because it's something that we don't call it that usually when we're in the context in which we're working. And this is what's so interesting about this conference, is that it brings together all these different sectors and different lines of work that people, and even different vernaculars, different ways of talking about issues. And that's one of the things that we have found with our framework, is that we're often helping people have a language around some of these issues that they're talking about that they never had before. And so even just this concept of readiness is really valuable for us. So let me invite Charles or Alexis to answer first, if you gentlemen would like to, and then I can also weigh in on that interesting conceptualization. And guys, don't forget to unmute. Alexis.
I would like to address that within the context of what we all mentioned actually during our presentations. In our context, the readiness may be related to the timeliness and the circumstances, which in your slides, one of the elements were exactly that. But not only for the innovation itself, but also for all the other components. And in this case, the timeliness can be related to the environment in which the scaling up will take place. Let me give you an example for this case that was presented. When we were ready to start the scaling up phase, it coincided with the elections period in the country. Some of the movement were kind of very difficult to do. So despite of that situation, the government authorities were so committed to make sure that this new curriculum goes and is really anchored in the nursing system, that they made some arrangement to make sure that that element of the context can be mitigated, and we were able to go into the 2 provinces before the elections were starting, and it continued after the election, and now we are really having the possibility of going much further. Another element of readiness should be dealt with when we are dealing with the expansion, for example, because it seems that it needs to be taking into consideration all the other contexts in which the innovation will be adopted and implemented at large scale. So readiness is kind of a cross-cutting or issue of during the scaling up phase. Thank you. Over
Yes,
to you, Laura.
that was a wonderful answer, Alexis. I don't have anything to add, but I would like to invite Charles to weigh in on that question. And then he's going to move straight into addressing Lindsay's, which I can announce, or Charles, you can. Go ahead, please.
Okay, thanks. I agree with my colleague Alexis, but I still want to emphasize that Kit raised a very pertinent question on community readiness, not necessarily community, but readiness at different levels. Now, for our case, for instance, we are handling, or our focus was a multiple or multi-sectoral integrated project. And this was divided in different sectors. You have the population folks, you have the health folks, you have the environmental folks, all familiar with their vertical approaches, kind of a silo mentality. And then you are interesting them to a new innovation that is integrating both. And that actually readiness is a key question. And the question of readiness can delay or accelerate the scale up. So I think for me, my experience indicates that it has to be a focus at all levels and at all stages of the of development of scale up, because we got quite a number of challenges getting to even the Ministry of Health to introduce them to integrate environment in their work. It doesn't work for us. Our budgeting are vertical, and we seem not to be ready for that. So going process is the engagement. We have emphasized much on the multi-stakeholder mapping and then engagement, which is a continuous process, generating evidence, and also trying to come up with the easy tools that can easily be accepted. But also we notice that at community level, the readiness sometimes can be something a bit crazy, because what Laura talked about, spontaneous scale up, we are even as we are at a time when we are not ready to scale up or to expand our interventions, communities were already doing some practices, and I wouldn't say it was a full package, but at least if they plant some trees, maybe not in the right order, and they continue doing some elements of the package or some elements of the innovation, sometimes we have less control over that, and I wouldn't say they are ready, but at least that is more of a quick win if you want to look for areas of expansion. I remember one of the community across the island that came and stole, stealing, like you steal the trees from the nursery, and then you go and plant, because it looks to be very attractive and interesting idea across, that the people are doing tree growing and integrating them with the livelihood as well as family planning aspects. So he wanted to move first to do a model, but we had no control over that. So sometimes, depending on what level, readiness is very critical. But again, I need to emphasize management scale up. When you manage scale up, and at what point do you think scale up? I mean, do you think scale up? Because many times we spend a lot of time asking, does the pilot project work? Does this innovation pilot work? And this is not enough, because it is important to keep asking right from start, what happens beyond the pilot if it works? So I think that is very, very, very critical also to look at how best you can bring different stakeholders as well as capacity, because we emphasize a lot of capacity in our presentation, and as well as the tools that guide the process. So I think that should be a continuous process right from start, but we need to gun on community readiness. Otherwise, acceptability of the community, getting a new user organization on board, having all these vertical, including traditional resistant entities, for instance, under family planning, where you have less male involvement, or some sects of Christianity that don't want to either promote family planning. All of these things come into play. And that's why it is very important to keep analyzing the innovation across a number of variables, like we mentioned. So it should be an ongoing process, and keep on innovating actually within the innovation. I think that makes slight easy, but it doesn't also give the assurance for a smooth flow. You will always find some difficulties. There was a good question. Maybe Laura, you can remind me.
Yes,
I think it was from
Lindsay. Happily. It's Lindsay's asking the question. She would love to hear experiences about sustaining the scale-up successes. What strategies do we use to ensure sustainability? That is a brilliant question too. These are great.
Yes.
Charles, go ahead. You start, and then Alexis will also weigh in.
Yeah, it is a very brilliant question, because of course, according to the guidelines, the tools we have, they are those layers, which is more of 3 levels. I think everyone is now familiar with those layers of start, then developing the scale-up strategy, and also managing scale-up. But the key question in our experience at the East African level, we wouldn't consider our project to be scaled up or successful if we didn't garner down or get some kind of outcomes on institutionalization. Because you need the government to accept, to integrate into their plans, for instance. And that is sustainability in itself, because at least, as I mentioned, that you do have some kind of funding even attributed to that. You have policy frameworks and the plans integrating in the innovation at different levels, but also you have got models within community level that are replicating either spontaneously or just expanding with or without the original team, what we call not the experts, but the original innovation team or project team. Then you also need to have new user organizations working out on their own. Otherwise, it becomes incomplete. It doesn't actually have generally we need to consider pilot as a building block. So we don't see pilot as viewing it as a project of its own or a net of its own. You need a new user organization trying to replicate the model and making it as simple as possible. So without institutionalization, without policy frameworks and the plans integrating, and without having new user organizations, without expansion, without building community structures, stronger structures, I don't think that makes a scale up sustainable. Otherwise, it becomes more of a projectized scale up. We just want to see it beyond. Even without our presence, that gun and the momentum built within community at local level, national, regional level should continue. I just want to give an example that on our case, even when the project ended, you do have other institutions like the Lake Victoria Basin Commission looking for funding because it is already in their plan. The East African community is already having a strategy to implement that, and we are not there. But you know, our success has informed the design. So you have almost all 6 East African countries integrating population health and environment within their plans. And the line ministry is also doing that cross-sector planning and implementation. For us, we look at that as a key success. And I hope Laura and Alexis can add to my submission.
That was wonderful, Charles, and it's very exciting for us to hear about, you know, in the more recent years, how far things are really going based on what those little seeds that we planted back in 2012. It's tremendous. So, and one thing I might have liked to hear you talk about, which I can add from the HOPE-LVB experience in terms of sustainability, is that one of the you heard Charles talk about how we involved the district level folks whose jobs were already to do the kind of work that HOPE-LVB was wanting to see happen, but they didn't have the capacity. So part of what HOPE's strategy was, and Charles had that nice quote from the reproductive health point person at the sub-county level in Kenya that talked about, we appreciate how HOPE-LVB is using our system and our workers. So when you do that, when you work with that kind of mindset, we call it a scaling up mindset and a sustainability mindset, you seek to empower the system that already has this role in its job description to do the work that they should be doing, that they don't have capacity to be doing. And in that sense, you're institutionalizing sustainable scale-up capacity, and you're sustaining it right in the system. And the other interesting thing that Charles sort of hinted at was at the community level, when you try to build the capacity for scale-up within the community so that they can share the learning that a smaller number of people had with the rest of their community, and you kind of bake that into the model, as HOPE-LVB did with using the model households you heard Charles talk about. It was part of the role of a model household to disseminate the learning that they were gaining. So in that sense, those households, they don't leave, they're there forever. And they, you know, they age and younger ones come up, but they're acculturated in this model of implementing PHE in their lives. And so that sort of institutionalizes and sustains that capacity. Let me turn the floor over to Alexis. Please, Alexis, go ahead and you talk about your perspective on sustaining the gains made during scaling up process.
Thank you, Laura. This is one of the key principles of scaling up, which we put very clearly in the process for developing a strategy, that it has to be a concern that not only we'll do a systems thinking, systems with regard to the framework we have, but also systems with the rest of the system where the innovation will be scaled up. So it's a key principle of, we make it clearer alongside with gender, equity, and so on. It's one of the key concepts that we want definitely to people to understand and keep in mind, that it will be throughout the process. And it seems that it will be related not only to the innovation itself. In this case, we recommend that it should be as simplified as possible, because when it is too complex, it may be adopted but not necessarily sustained. And one of the lessons we are learning from this experience I shared was the necessity to have somebody within the decision-making position who is really committed and ready to defend this innovation as long as he's in place. And despite of the changes which do happen in the system, especially in the health system, those who came in to replace those who left were also committed to make sure that this is something which they want to be part and parcel, because it is a major gap which was identified during the National Development Plan for what they call here PNDS, Plan National de Développement Sanitaire, which makes sure that the gap which is glaring this time, which show that most of the nurses who have been trained so far are unable to deliver services at the community level. And we are going to make sure that the competencies needed to do so are actually sustained within the nursing school system, so that at the end, we will not necessarily need to do other training for family planning, for example. So it was in mind the sustainability aspect. So the user organization has to have that in mind, as well as the whole resource team. The continuity which we mentioned earlier, Laura mentioned in her presentation, is key here, because most of the time, the attrition, especially within the health system, is very high. So sustainability will definitely be a cross-cutting element of all the process, and we need to continue the analysis throughout, as Charles mentioned, because the windows of opportunity come and close very quickly. We need to make sure that we can react and continue the move. Up to you, Laura.
Thank you, Alexis. So Lindsay is asking a follow-up question, which I love. And it is, once you achieve institutionalization and have more permanent funding, do you have a continued role in monitoring implementation, or do you phase yourself out? And I really like this question because, well, in part, who you are is a question, Lindsay, and maybe you want to, we only have 1 more minute, so I'll just answer quickly. One of the things that I talk about when I'm often talking to resource teams is, I would really hope that you will be working yourself out of a job, because that's what you really want. You don't, if you're an NGO and you're supporting a scale up process, you don't want to always have to be part of that process. You want to empower the system so that it can, you know, continue scaling up, because scaling up doesn't take place rapidly. There's some estimates that it's often an average of 17 years, but I think it's a lot longer depending on the intervention package. And but the issue of having permanent funding doesn't mean that the implementation will always proceed, you know, exactly as we would hope. And so that's where careful monitoring and adaptive management of the scaling up process play a critical role. And there need to be people who are acting in that capacity and playing that critical role. And one of the things that we often recommend is, as part of the scaling up process and its management, is strategically managing it, one can revisit the strategy that was developed to make sure that it's proceeding appropriately. Sometimes it may need to be repeated in light of different changes that are taking place either in the user organization, which, as Alexis just pointed out, there's often a lot of turmoil in the user organization. It's in constant flux, but also the larger environment in which scaling up takes place. And we need to be scanning these things to make sure that we're proceeding well. So it is time to wrap up, and I really want to thank you all for joining us. I want to point you again to the ExpandNet website at expandnet.net, and hope that you will make use of the tools there and that you will reach out to ExpandNet and tell us how you've used them. We love to hear from people through the Contact Us, and we wish you very good luck in your scale-up work as part of implementation, and that you will benefit from our learning and carry all of your work forward. So good luck, and thank you to Alexis, to Charles, to Felicia, and to our Samantha, our transcriber and captioner. Thank you, everybody. Best wishes, and please stay safe. Thank you.
Thank you, Laura.
Okay.